So we're going to talk about opioids today. Opioids are drugs or medications that help relieve pain mostly when you're using them medicinally. People also abuse them for the potential that they, cause euphoria in people abusing them. Now, we must understand that we'll be keeping the USMLE step 1 in perspective here. I'm sorry, in perspective here, and we'll be talking about opioids with respect to that. Now, opioids, let's understand, they act on three receptors: the mu receptor, the which is also called the beta endorphin receptor. So the mu receptor is the beta endorphin receptor. Then you have the delta receptor, which is the enkephalin receptor, and the last one you have is the kappa receptor, which is the dynorphin receptor. Now, opioids are drugs that are usually agonists, almost mostly agonists at these three different receptors. And you must understand that if you have a receptor, a drug which is going to, activate these receptors in the body, these receptors lie at various parts in the body, at various places of the body. The mu receptor is going to give you analgesia, for which you're going to use this medicinally. It also gives you respiratory depression, which is going to be a toxic side effect of this fatal side effect of these drugs. It also gives you euphoria, for which it is abused, and then sedation. These are all the properties that you get from mu receptor. Delta receptor is usually analgesia, not that much, but it gives you analgesia. And kappa receptor, the most notorious receptor because it gives you, nightmares and hallucinations. So this is a receptor we do not want to really activate, and this is the dynorphin receptor. So in the same patient, you can have variety of, things happening. Now let's understand the mechanism of action of these opioids in simple terms. Okay. So opioids, what do they do by acting on the mu receptor? Once the mu receptor is stimulated, it goes on to, close the presynaptic. So if you have this, I'm gonna remake this thing for you to make it easy. So imagine this is a neuron, and this is a synapse, let's say. So the idea is that there are voltage gated calcium channels here and potassium channels here. And what the mu receptors will do is once the mu receptors are activated, they're going to, block this calcium channel and open up these potassium channels. So the idea is that whatever neurotransmitters were here won't be able to come out, because you have to go back to physiology and understand the opening of calcium channel causes the efflux of these neurotransmitters. So the neurotransmitters are not going to come out, and the opening of potassium channel and the leaking out of potassium is going to result in repolarization, which is going to stop the nerve impulse. Eventually both these, come together hand in hand and stop nerve transmission. So if there's going to be any pain, that pain will not be taken up to the to the central nervous system, to your thalamus, which is going to interpret that there is some pain. Now, also we must understand that there are these drugs, there are varieties of drugs. For example, you have full agonists, meaning these drugs are going to act as a full agonist at these mu receptors, at these opioid receptors. And the drugs include morphine, heroin, the most abused drug. So morphine, heroin, and then you have meperidine. And remember, meperidine has a few different things that you have to remember about it. One of those is that meperidine is the longest acting here. And the second point you have to remember is that it causes mydriasis. When we talk about the side effects of almost all opioids, one of the side effects that you have to remember is this: opioids will cause meiosis, that is constriction of your pupil. Not just that, this is one side effect to which tolerance does not develop. Along with constipation. What am I talking? If you're not getting any of it, please don't bother, because we're going to come back to this again. So remember, meperidine causes mydriasis, and meperidine is the longest full agonist that we have. Then we'll talk about the partial agonists. The partial agonist drugs that we have, partial agonist opioids that we have. First one you have to understand is pentazocine. Second one you have is buterphenol. And the third one you have is buprenorphine. And then you have the antagonist drugs, which are naloxone, naltrexone, and methyl naltrexone. Now, what are the clinical uses of these drugs? Let's understand. The idea that I tried to convey here, what the hell is wrong here? Okay, just give me a second, please. Okay, remember the idea that we talked about here, that these opioids are basically causing nerve impulse, transmission cessation. It's going to stop the impulse to go to the next nerve fiber, eventually leading to brain. So that is why it is given for refractory or moderate pain. Now, opioids have a side effect that it causes, okay, we'll talk about that later. Like morphine is one drug which is given for pulmonary edema. A lot of you tend to ask me why it's given for pulmonary edema. Let's understand why morphine is given for pulmonary edema. Morphine is given for pulmonary edema for two reasons. First, it is causing vasodilation. So vasodilation in your body will lead to a decrease in fluid going to the lungs. So that eventually leads to betterment, and the more important effect is going to be it causes decreased anxiety. So the patient is already anxious because he's not able to breathe, and an increase in anxiety is a big trouble, and that's why morphine is given for pulmonary edema. You can also give them for neonatal abstinence syndromes and maintenance program for opioid use disorders. Let's talk about the side effects of opioids now. So mainly opioids are concerned, the use mainly is going to be pain, and here in morphine it is given for pulmonary edema. Now remember that one of the side effects of opioids is that it causes constipation. Now because they cause constipation, they can be given for diarrhea. And that is why the third use of opioids is going to be diarrhea. They can be given for diarrhea. If the patient has diarrhea, it will cause constipation. I mean, it will stop the diarrhea. Other adverse effects can be, you can have nausea, vomiting, pruritus. Remember, pruritus is going to be a non-IgE mediated pruritus. I mean, the opioid particle itself stimulates the histamine, the mast cells to release histamine. You can have opioid, you can abuse them, so you might have opioid use disorders, respiratory depression, constipation, I told you, and then you have sphincter of Oddi spasm. And because of the sphincter of Oddi spasm, let's understand, this is your system, this is your biliary tract, this is your pancreatic, this is your sphincter of Oddi. If you cause the spasm of the sphincter of Oddi in a patient who's already having an increased pressure here, it can lead to rupture of biliary tract. That is why for biliary colics, you never give the patient morphine, understand that. Then you can have meiosis, I told you, except meperidine, which causes mydriasis. You can have CNS depression, tolerance does not develop to meiosis and constipation, and you treat the toxicity with the antagonists. We have few drugs which are called mixed antagonists and agonists. If you remember, I told you in the beginning that most of these receptors are activated by opioids, but you have some drugs which are agonists at one receptor and antagonists at the other receptor. One of those is pentazocine. It's very commonly used if you go to hospitals. The idea is that pentazocine is a kappa receptor, agonist, and a mu receptor partial agonist or an antagonist, and that is why you see pentazocine is related to a lot of night hallucinations or night dreams. Then you have buterphenol. It's also the same thing, except that it's just a partial agonist at the mu receptor, but not an antagonist. The third drug you have is going to be tramadol. Now, tramadol is a very weak opioid. Remember, it's very weak. Along with the function of acting as opioid, it also blocks the uptake of serotonin and norepinephrine in your spinal cord. Tramadol can cause serotonin syndrome, and it can lower the seizure threshold. It is also so these are things that you have to remember about opioids. Thank you. Oh God, how do we close it?